Most people over 65 are told the same thing about memory trouble. They are told it is simply old age. It sounds sensible. It sounds like something you just have to accept. But here is what almost nobody tells you. Age alone does not explain why your memory got foggy this year and not 5 years ago. Pharmacists see this every single week. A person walks in worried they are losing their mind, and very often the real cause is a common pill they have taken for years, or a new one added just a few months ago. Today, I am going to walk you through 5 kinds of everyday pills that can quietly cloud an older mind, and I will give you the exact question to ask your pharmacist that most people never think to ask. The number 1 item on this list is something almost nobody talks about. Stay with me until the end, because that one question can change how clear your thinking feels over the next 10 years. Here is the problem with a 12-minute appointment. Your doctor is watching your blood pressure, your sugar, and your heart. There is barely time to review one condition, let alone every pill on your list. Nobody sits down and adds up how all those pills work together inside an older body. And most of these memory pills are not even prescriptions. They are things you bought yourself at the pharmacy for sleep, for allergies, for a stuffy nose, so they never make it onto the list your doctor reviews at all. I want to be clear about something before we go one step further. I am not here to sell you a supplement or scare you into a course. This channel exists to give you the science a 12-minute appointment never has time to cover. And nothing on this list means you should stop a pill on your own. Because a foggy memory is not just about forgetting a name. It is about missing a pill or taking it twice by accident. It is the moment your family starts to wonder whether you can still live safely on your own. So tell me in the comments, how old are you and which country are you watching from? I read them and it tells me exactly who I am helping tonight. Here is the one idea that explains almost everything on this list. Deep inside your brain, there is a messenger chemical called acetylcholine. It is the chemical your brain leans on for memory, focus, and staying sharp. And a whole family of common pills quietly blocks that exact messenger. Picture a busy post office inside your head. Acetylcholine is the mail carrier, delivering every memory to the right address. These pills are like locking half the mail carriers out of the building. The letters do not stop arriving. They just pile up, undelivered, and your thinking feels slow and scattered. Please do not skip this section. It is the key to everything that follows. If this is already making sense to you, tap the like button so more seniors can find it. That one tap is how this video reaches the person who needs it most. Let us start the countdown at number 5. Number 5 is the old-style antihistamine, the kind hiding in many nighttime and PM labeled pills. You know these already. The allergy pills that make you drowsy, and the sleep aids with the letters PM on the box. The active ingredient is often something called diphenhydramine. Here is why they cloud your thinking. That drowsy feeling is not harmless. These pills are strong blockers of the memory messenger we just talked about. Remember the post office. This is one of the pills that locks the most mail carriers out at once. This is not a fringe idea. Geriatric specialists keep a well-known list of medicines that are risky for older adults, often called the Beers list. These antihistamines sit right near the top of it. So here is what to do. And notice I am not telling you to quit anything. Tonight, go read the box on every sleep and allergy pill in your house. Look for the word diphenhydramine or the letters PM on the label. Write down every one you find. Then bring that written list to your pharmacist within the next week. Ask them one simple thing. Is there a version of this that does not block my memory chemical? For allergies, there are newer once-a-day pills that do not reach the brain the same way, and a pharmacist can point them out in about 2 minutes. Now the safety part, and this matters. Do not stop a pill your doctor prescribed on your own. If you take one of these for a real medical reason, raise it with them before you change a thing. And if you ever feel more confused or unsteady after any new pill, that is your signal to call the pharmacist that same day. Pair this with better sleep habits because most people reach for these pills over sleep they could fix another way. Keep your bedroom cool and dark and put the screens away 30 minutes before bed. Better sleep is the reason many people will not need that PM pill at all. But maybe your sleep trouble is bigger than a habit. Maybe a doctor already gave you something stronger to help you rest at night. That is a different kind of pill with a different risk, and it is exactly where we are going next. Number 4 is the prescription sleep and nerve calming pills. Doctors call them benzodiazepines, along with their newer cousins, the Z drugs. These are the pills many people take to fall asleep or to quiet a racing mind. Here is the trouble. These pills slow down the whole brain to help you rest. In a younger body, most of it clears out by morning, but an older body breaks them down far more slowly. So the calm that was meant for bedtime can still be sitting in your brain at 10 the next morning. Think of it as a fog that was supposed to lift at dawn, but lingers past noon. These pills sit on that same well-known list that geriatric specialists flag for older adults. Large studies have consistently linked long-term use with both memory trouble and falls. Here is your safe next step, and again, no quitting on your own. In fact, these are pills you must never stop suddenly because stopping cold can be dangerous. Instead, book a visit with the doctor who prescribed it within the next 2 weeks. Ask this exact question: can we make a slow plan to lower this over time? A careful step down might lower the dose by about a quarter every few weeks, but only your doctor sets that pace. And ask what you can lean on for sleep while you step down. And this is exactly the pill that the #1 question at the end is built to catch, so keep watching for it. While you wait for that visit, do not double up on a bad night. If one pill did not work, taking a second is exactly how an older person ends up confused or on the floor at 3 in the morning. And if you feel unusually groggy or unsteady in the morning, tell your doctor before your next dose. Pair the step down with a fixed wake-up time, the same hour every single day, weekends included. A steady wake-up time is the strongest natural sleep signal your body owns. It makes the whole process far easier on your brain. So far, we have talked about pills you take on purpose to sleep. But some of the worst memory offenders are pills you take for something that seems to have nothing to do with your brain. The next one hides inside a very common problem below the belt, and hardly anyone connects it to their thinking. Number 3 is the pills for an overactive bladder, the ones that calm those sudden, urgent trips to the bathroom. A very common one is called oxybutynin. Now here is the catch that almost nobody explains. These pills work by blocking that same memory messenger, acetylcholine, to quiet the bladder muscle. But that messenger is not only in your bladder, it runs all through your brain. So the very same pill that calms your bladder can quietly fog your mind. In the post office, you locked out the carriers just to slow one busy hallway, and the whole building slowed with it. This is well documented. That same geriatric list flags these older bladder pills, and studies have tied them to slower thinking in older adults. So here is your move, and once more, change nothing on your own. Write down the name of any bladder pill you take and bring it to your pharmacist this week. Ask whether a newer kind of bladder medicine might suit you, one that does not reach the brain the same way. There is a whole different class, sometimes called a beta-3 medicine, and your doctor may be able to switch you. While you have their ear, ask about simple bladder training too. Try emptying your bladder on a schedule, about every 2 to 3 hours instead of only when the urge hits, and ease up on caffeine and on drinks in the 2 hours before bed. Here is the safety line. Do not stop a bladder pill suddenly on your own, and if your confusion ever gets worse after a change, call your pharmacist that day. Pair the medicine review with pelvic floor exercises, the gentle squeeze and release you can do sitting in any chair. Stronger pelvic muscles mean fewer urgent trips, which can mean less need for the pill in the first place. But here's the truth about everything so far. One pill on its own might only fog you a little. The real danger is when several mild ones quietly stack on top of each other, and that stacking effect is number 2. Number 2 is not a single pill at all. It is the pile. Doctors even have a name for it, the anticholinergic burden, and it is the total weight of every memory-blocking pill you take added together. Here is why this is the sneaky one. Each of these pills might only lock out a few mail carriers, one mild allergy pill, one bladder pill, one older pill for the stomach or the mood. On their own, each feels harmless. But take 3 or 4 mild ones together and you can block as many carriers as one very strong pill would. The post office is not just short-staffed now, it is nearly empty. This is real enough that doctors actually score it. There is a measure, a burden score, that adds up how much of this effect all your pills carry together. And large studies have consistently found that the higher that total climbs and the longer it stays high, the greater the risk to memory over the years. So here is the most powerful thing you can do this week, and it is beautifully simple. Do a brown bag review. Take a paper bag and put every single thing you take into it. Every prescription, every pill from the pharmacy shelf, every vitamin, every supplement, every patch and eye drop. If you count more than 5 different medicines, you are in the zone where this stacking really matters. Carry that bag to your pharmacist and let them add it all up. Here is the safety rule for the pile. You never unpick a stack of medicines yourself. Lowering them is done carefully, one at a time, and only by a professional who watches how you respond. Pair the brown bag with one clean written list of everything you take kept in your wallet. Update it every time a pill changes. That single sheet of paper can protect your memory more than any supplement on the shelf. And that brings us to number 1. Everything we have covered points to one single conversation, one exact question that ties it all together. It is the thing almost nobody thinks to ask, and it is coming up right now. Here it is. Number 1, the crown of this whole list, is the one move that protects everything else. It is a full medication review with your pharmacist built around a single question. Write this question down. Which of my medicines could be affecting my memory and what are the safer choices? Now let me tell you why this one sits above all the others. Your pharmacist is the true medicine expert on your team. Your doctor knows your diseases, but your pharmacist knows your drugs, all of them, and how they behave together. They see the prescriptions and the pharmacy shelf pills side by side. They can add up that anticholinergic burden we just talked about. They can spot 2 pills that quietly fight each other. And they usually know a gentler swap for almost every risky one. Think of it this way. All video long, we have been finding locked doors in the post office one at a time. The pharmacist is the manager who walks the whole building, checks every locked door at once, and knows which keys are safe to turn. This is not a niche idea. A pharmacist-led medication review is a recognized, studied part of good care for older adults. Deprescribing, the careful art of removing pills that no longer help, is now written into geriatric guidelines. And reviews like this have been shown again and again to catch risky prescriptions that everyone else missed. So here is the fullest plan in this whole video. Call your pharmacy and ask for a medication review, sometimes called a brown bag review. Many pharmacies offer it, and it often takes only 15 to 20 minutes. Bring everything, and I mean everything. Prescriptions, pharmacy shelf pills, vitamins, supplements, patches, creams, and eye drops. Then ask your 4 questions. 1, which of these could be clouding my memory? 2, what is a safer version of each? 3, is there anything here I no longer need? 4, please add up my total burden score. Ask for the answers in writing. Then carry that written plan to your doctor within 2 weeks because the pharmacist advises and your doctor makes the change. And do this once every year or any time a new pill is added. Now the safety heart of this whole video, so please hear me. Your job is to gather the information. The professionals make the changes. Never stop a single pill because a video told you to. A proper step down is slow, one medicine at a time, and always watched. Some pills for the heart, for seizures, or for the nerves must never be stopped abruptly at all. And if new confusion ever appears after any change, call that same day. New confusion is always a reason to pick up the phone, never to wait and see. Pair this with one trusted person who knows your full list, a spouse, a child, or a close friend. Keep that one master list updated and bring it to every appointment you have. 2 sets of eyes on your medicines are far safer than one. And here is why this is number 1, the thing almost nobody talks about. This conversation costs you nothing. No company profits from it, so no advertisement will ever remind you to have it. Yet this single review can protect your clarity, your independence, and your memory for the next 10 years. That is the payoff I promised you at the very start. Consider a typical case documented in the geriatrics and rehabilitation literature. Picture a 74-year-old woman, sharp her whole life, who slowly grew forgetful over a single year. She started misplacing simple words in the middle of a sentence. She forgot 2 appointments in 1 month. She left the stove on twice. Her daughter quietly began to wonder if this was the start of dementia. But no one had ever counted her pills. She was taking a PM sleep aid most nights, a bladder pill every morning, and an older pill for low mood. So she did the one thing this video asks. She brought them all in a paper bag to her pharmacist. The pharmacist added up her burden score, and it was high. Over the next 2 months, working only with her doctor, they swapped the sleep aid for better sleep habits, changed the bladder pill to a brain-safe kind, and gently lowered the old mood pill. The change was not magic, but it was real. Within a few weeks, her words came back to her. She was remembering her appointments again without a note. Her daughter said it was like getting her mother back, and no one had to say the word dementia. The fog was never her brain failing. It was the pills, quietly stacked, and it lifted once they were sorted. So let us turn all of this into a plan you can start tonight. Keep it simple and keep it safe. Tonight, do one thing only. Read the box on every sleep and allergy pill in your home. Write down anything that shows the letters PM or the word diphenhydramine. This week, book your medication review. It is 1 phone call to your pharmacy, and you simply ask for a brown bag review. That single call is the most important minute of this whole plan. At that review, ask your 4 questions and get every answer in writing. Which pills could fog my memory? What is the safer version? What can I drop? And what is my total burden score? Within 2 weeks, carry that written plan to your own doctor. They make the final call on every change because a safe step down is always slow and always watched. And from now on, keep one master list of your medicines in your wallet. Go through the whole list once a year and every single time a new pill is added. Now, think of someone in your life who has been getting foggy and who takes a handful of pills every day. A parent, a spouse, a neighbor down the street. Send them this video tonight. It might not be their memory at all. It might be the pills, and this could be the thing that gives them their clarity back. Tell me in the comments which of these 5 you are starting tonight. Your answers decide exactly what I cover next. And if you want the science a 12-minute appointment never has time to cover, subscribe to this channel and stay with me. This video is education, not a diagnosis. Your own doctor knows your history, so bring this list to your next appointment. I'm Judy Vance. Don't forget to subscribe and live longer.